So this lovely patient, this is a personal favorite of mine actually, really nice guy, and he wasn't happy with the sizing of his teeth and the color, and the main problem that he didn't like was the gap between his two front teeth. So we discussed loads of different options, and I told him if we wanted to build up the teeth at the moment, the main problem was the bite. So his bite was really restricted. So his top teeth, you can see on this photo, cover the lower teeth quite significantly. So where you see the edges of the top teeth and the bottom of the bottom teeth, there's not a lot of space. This is called a deep overbite. And patients that have deep overbites often tend to have a lot of tooth wear around the edges. Because their bite is restricted, it means their front teeth are a lot more in contact than they should be. And so over time they're damaging. So I basically explained that we had to open up the bite a bit first before we were to build up the teeth, which a lot of the time patients, obviously that's not their role. They don't kind of think about those things, which is why a thorough assessment is really important with a skilled clinician to advise you what are the best options. So had I have done composite bonding without doing Invisalign, he probably would have chipped those really quickly, and obviously that would be a not a happy patient. So what we first did using Invisalign, we straightened the teeth, and also I closed the gap at the same time, which took us to about here. So he did a bit of whitening. The gap between the two front teeth, you can see, has closed nicely, and the overbite has also improved. So already we're in a much better position than we were when he first came in. And then we layered composite onto his teeth, and we got some really nice results at the end. It also meant his teeth didn't look as small as they were. He's quite a big, tall guy, and he was a lot more confident with his smile. You can see the edges of the lower lip kind of follow the lip line. The colors improved, and the shape and texture look like real nice teeth. So blending composite is also really important to do, because you don't want the composite to stand out. You want it just to blend nicely with the rest of the teeth. This is a very popular treatment, which we also offer. And again, it's all very tailored and it's very case selective. So it's something that having the initial consultation with myself will really help you understand. And then together we can decide what are the best options to achieve the smile that you want in the most conservative way. And we will factor in obviously time frame and budget as well, because that's obviously very important for patients. So if you're interested in improving your smile, then the best way would be to contact the practice. There's a link in my bio which will take you directly to a web page with all the information there for you to take the next step.